Welcome back, everyone. We're diving into something you might not expect today. It's a look at how Taiwan and universities in Africa are teaming up.
Yeah, it's a fascinating area.
I know a lot of you are really interested in global health, and, well, this is where things get really interesting. We're not just going to be talking about research papers here. We're talking about real-world impact.
Mhm.
We're talking about action against some really serious health challenges,
Absolutely.
specifically tuberculosis.
And what's really striking is just how much collaboration is going on. It's not just a small project here or there. We're seeing Taiwanese universities working with institutions in, well, both Eastern and Southern Africa.
Right.
And they're sharing knowledge, resources. It's a real win-win. Taiwan gets to contribute their expertise, and African institutions get support, training.
So let's get into specifics. One project really caught my eye, and it focuses on multi-drug-resistant tuberculosis in Namibia, MDR-TB. Now, most of you probably already know that MDR-TB is a huge problem because it's resistant to the usual medications. But the thing is, accurately diagnosing MDR-TB in a place like Namibia with limited resources, that adds a whole other level of complexity.
Yeah, exactly. It's a tough situation, and that's where this project, it's called H3TB, that's where it comes in. They're trying to find and treat cases early before they spread further. And the way they're doing that is, well, they're focusing on specific groups that are most at risk. So people who visit hospitals often, those living in certain geographical hotspots.
Okay, so they're being very strategic with their targeting. But what really surprised me was the involvement of the Acer Foundation. They donated, get this, 300 laptops to the project.
Mm-hmm.
I mean, we usually think of Acer in terms of, technology, not global health initiatives.
Right. It's an interesting connection, isn't it? But it really highlights how technology is actually transforming healthcare, especially in settings where resources are limited. Those laptops are absolutely key for collecting data, tracking cases, and ultimately helping researchers understand how MDR-TB is spreading within Namibia. But here's the key part. Once the project wraps up, those laptops, they stay with the University of Namibia.
Wow.
Talk about long-term impact.
That is huge, a real win-win. And speaking of impactful collaborations, this project has brought together some serious brain power. You've got researchers from Taiwan's National Taiwan University, NTU, working alongside experts from the University of Namibia, that's UNAM, and even folks from Stellenbosch University in South Africa and Imperial College London.
It's a truly global effort.
It is.
Yeah.
And it's not just a random group of institutions either. I mean, the project lead, Professor Mareli Misha Claessens from UNAM, she actually has a connection to the professor leading the team from NTU.
Oh, interesting.
They've collaborated before, which I think shows how important personal relationships are in facilitating this kind of global cooperation.
Yeah, for sure.
It's almost like a scientific reunion, right? Bringing together all this expertise from different parts of the world to tackle this challenge. But this isn't just research for research's sake, is it? What kind of real-world changes are we seeing as a result of this project?
No, not at all. The H3TB project is making a real difference in Namibia. They've been able to upgrade lab equipment at UNAM specifically for studying tuberculosis, which will have benefits even after this project is over.
That's great. Namibia has a high burden of TB, so anything that builds up their capacity to address it is crucial.
Exactly.
Giving them the tools to fight this disease, not just today, but for years to come.
Exactly. And it's not like they're working alone, Namibia works with partners from all over the world to fight TB. This project with Taiwan is just one part of a much bigger effort.
So it sounds like a really comprehensive approach.
Yeah.
But what I find impressive is how the project goes beyond just identifying cases. They're using mathematical modeling developed at NTU to actually predict the impact of early detection.
Yeah, that's where it gets really fascinating.
Yeah.
Using data to model different scenarios, researchers can figure out how to tailor interventions, make them more effective, and they can make sure resources are going where they'll have the most impact. Plus, they're also looking at the economic burden of MDR-TB, what it costs patients.
That's a really important point because understanding the financial strain can help shape more effective solutions, better support systems.
Exactly. You're not just treating the disease itself, you're addressing all these ripple effects it has on people's lives.
Right, it's a much bigger picture.
Right, and that's what makes this research so valuable. And these findings, they aren't limited to Namibia.
Oh, okay.
The insights from this project can be applied to other regions, other diseases. It could potentially have a global impact.
Wow, it's amazing how one project can have such far-reaching implications. And we can't forget the people doing this work. There's a Namibian PhD student and 3 master students who are involved, getting incredible experience. I bet they're learning a ton from the Taiwanese researchers.
Absolutely. This type of knowledge transfer is essential for building long-term capacity in Namibia, empowering the next generation of researchers and healthcare professionals.
Okay, so we've talked a lot about the MDR-TD project, but
Right.
you mentioned earlier that there are other partnerships between Taiwan and African universities. Can we zoom out a bit and look at the bigger picture? I mean, it's not just NTU involved, right?
Right. It's a whole network of institutions. On the Taiwan side, you have National Taiwan University of Science and Technology, National Taipei University of Nursing and Health Sciences, and China Medical University, just to name a few.
Okay.
And in Africa, we're talking about the University of Livingstonia in Malawi, Kisii University in Kenya, and of course, UManim in Namibia.
It's a whole web of connections.
Exactly. And the programs are diverse too. You've got distance learning initiatives that connect students across continents, student exchange programs, and specialized training programs in health-related fields. It's not just research, it's about capacity building at every level.
That's impressive. But what about the funding? Is it mostly coming from the universities?
Well, the universities play a role, but the Taiwanese Ministry of Education is really a major driver. They provide a lot of funding and support, which really shows Taiwan's commitment to these partnerships and to global health.
It sounds like they see it as a real priority.
Yeah.
So from your perspective, why is Taiwan so invested in these collaborations? What's the strategic importance?
That's a great question. Taiwan, with its technology and healthcare system, has a lot to offer. By working with these partners, they can contribute to global health, strengthen diplomatic ties, and show their commitment to international development. It's a way to make a positive impact on the world.
So it's more than just sharing knowledge, it's about building relationships.
Exactly. And the long-term benefits for African nations shouldn't be underestimated. These collaborations can strengthen healthcare systems, build research capacity, and train future healthcare professionals. It's an investment in a healthier future for the continent.
And speaking of a healthier future, I understand there are also collaborations focused on environmental health and climate action.
That's right, yeah. They're looking at some pretty crucial issues, things like access to clean water, the effects of climate change.
Right.
I mean, these are really complex challenges, and they directly impact public health. So it makes sense to address them as part of this whole collaborative effort.
It's all connected, isn't it?
Absolutely.
You have a healthy population without a healthy environment.
Exactly.
Sustainable development, that's the key to making sure we have both.
It really is.
It's really encouraging to see these collaborations taking this kind of holistic approach.
I agree, yeah. It shows they recognize that these global challenges, well, they need global solutions. And working together, collaboration, that's essential. You know, if we want to create a future that's sustainable and fair for everyone.
Well, we've covered a lot of ground today.
We have.
Unexpected partnerships, cutting-edge research. It's been fascinating.
It has.
What started as, a connection between Taiwan and universities in Africa, well, it's turned into this whole network of impactful collaborations, each one contributing to, a healthier and more sustainable future for everyone.
It's been a pleasure talking about all this with you. The level of innovation and dedication in these partnerships, it's really inspiring.
Before we go, I want to leave you with something to think about. We've seen how these collaborations bring together all this expertise, these resources, to tackle some really complex problems. But we also have to think about the long term. How do we make sure these partnerships continue, that the progress made isn't lost?
That's the big question, isn't it? I mean, building capacity at the local level, that's vital. But you also need ongoing support from everyone involved. It's about, creating that sense of ownership, ensuring that the knowledge and skills gained through these collaborations, well, that they stay in Africa, that they contribute to real lasting change.
It's about building bridges, not just temporary structures.
Right.
And that's what makes these partnerships so powerful. They're not just about right now. They're about giving communities the tools and knowledge they need to shape their own futures. If you're interested in learning more, well, there's a whole world of global health collaborations out there. From fighting infectious diseases to improving maternal and child health, there are countless inspiring examples of people coming together to create a healthier, more equitable world. And remember, this deep dive was made for you. If you want to go deeper into anything we talked about today, just let us know. We're always happy to explore further. Until next time, keep learning, keep questioning, and keep diving deep into the world around you.